Welcome to Physician Academy. Today I'm going to talk about hypertension. Hypertension is a sustained elevation in resting systolic blood pressure, usually greater than 140 millimeters of mercury, and diastolic blood pressure of greater than 90 millimeters of mercury, or having a sustained blood pressure elevated in both of those. The systolic blood pressure is the blood pressure at the top, and the top number when you read a blood pressure out, and the diastolic blood pressure is the bottom number. So you have like 120 over 80, your systolic is 120, your diastolic is 80. The diastolic blood pressure is the blood pressure that's the baseline pressure in the artery when the heart's not pumping, and the systolic blood pressure is the pressure when the heart is pumping. So the 120 over 80, the 120 is when the heart is pumping, the 80 is when the heart's not. At least that's a great way of looking at it. In the United States, 75 million people have hypertension. The most common kind of hypertension is primary or essential hypertension. That's hypertension with no known cause. And we think that accounts for about 90% of cases of hypertension. The other type of hypertension is secondary hypertension. So let's first cover primary or essential hypertension, which is no one specific cause. So it's thought to be a combination of causes. There are hemodynamic and physiologic components. Example, plasma volume, activity of the renin-angiotensin system, sympathetic nervous system. So common ones would be common causes for primary essential hypertension, which we do not yet test for, would be abnormal sodium pump transport pumps, meaning that people have varying functional sodium, potassium, and ATPase pumps that control the sodium ions transporting through the cell membrane. And it's thought that there's genetic variation, and so some people have abnormal pumps, which lead to elevated blood pressure. Another possible cause of primary essential hypertension is the sympathetic nervous system, a high resting pulse rate, which may result from increased sympathetic nerves. Activity is a good example and is a good predictor of hypertension. So it's just the sympathetic nervous system increasing the tension in the blood cells, in the blood vessels. Another possible component is the renin-angiotensin aldosterone system, which regulates blood volume and therefore blood pressure. And without a specific test showing that there's an abnormality in one of the levels, then that would be another source that's thought that variations in that system per person can lead to some people having high blood pressure. But at this time, we don't have a specific test for that. And vasodilator deficiencies, such as low bradykinin or nitric oxide, may also cause hypertension. Again, there's no specific test that we can say, oh, that's your cause of hypertension, and here's the correction for it. So primary hypertension is unlikely to have a single cause as well, which means that these people can have multiple, people with high blood pressure or primary essential hypertension can have multiple causes. They could have abnormal sodium pumps problems, sympathetic nervous system problems, renin-angiotensin, aldosterone cascade problems. All sorts of things can coalesce to cause primary essential hypertension. And it's also thought that there's a large hereditary component to this, predisposing to people developing high blood pressure over time. Secondary hypertension is hypertension that we can actually identify a cause. So, for example, primary aldosteronism, in which you can actually check levels. Renal vascular disease would be another one, or pheochromocytoma or Cushing's syndrome. These are all other causes of secondary hypertension, and when you correct the cause, the hypertension goes away. Just another example would be congenital adrenal hyperplasia, hyperthyroidism, myxedema, and coarctation of the aorta. Other causes for secondary hypertension would be excessive alcohol intake or use of oral contraceptives. So if you stop the alcohol intake, blood pressure would come down. If you stop the oral contraceptives, blood pressure comes down. Correct the renal artery stenosis, the blood pressure comes down. So those would be secondary hypertension, and you would correct the cause of the hypertension. Why is hypertension such a big problem? The biggest problem with patients is that they experience no symptoms unless there's hypertension is so severe and long-standing. But the big problem is it causes end organ damage. So organs that get damaged with high blood pressures, any organ that has a blood supply could possibly get damaged. So commonly hearts are damaged. They get with coronary heart disease, myocardial infarctions, congestive heart failure. Those are all common problems that occur, and then from high blood pressure. In the brain, you get cerebral vascular accidents or strokes or cerebral hemorrhages. In the kidneys, you end up with chronic kidney disease and renal failure. So all those lead to premature death. So what are some of the signs and symptoms of high blood pressure? Well, the biggest problem is that there are no signs and symptoms for a lot of people. They just don't feel anything. And they find the high blood pressure when they actually get their blood pressure checked. That often happens only when they go to a doctor's office. And of course, that's a stressful event for a lot of people, so their blood pressure might be high. So that's why in order to get a diagnosis of high blood pressure, we recommend that you check multiple times. Other signs and symptoms of high blood pressure would be dizziness, headaches, fatigue, sometimes epistaxis, which is a common one that they show in movies all the time. Oh, there's a big problem because the person has a nosebleed. A lot of epistaxis that shows up in my clinic ends up being from no cause specifically other than a dry mucous membrane. Severe hypertension can also show up as heart failure or encephalopathy or renal failure, and that's for long-standing undiagnosed hypertension. Also note that the fourth heart sound is one of the earliest signs of hypertensive heart disease. So if you manage to find, when you're listening to the heart sounds, if you hear a fourth heart sound, then you have a sign of hypertensive heart disease. Another way that some people are diagnosed is they go to their eye doctor and they see retinal changes, arterial narrowing, hemorrhages, exudates, papilladema. Those are all their signs, and sometimes you'll get patients that are referred to us from the ophthalmologist saying they came in because they wanted their eyes checked and the ophthalmologist said they have signs of hypertension. So how is hypertension diagnosed? So the blood pressure should be measured with the patient seated after resting for a couple of minutes, ideally more than 5 minutes. You need to make sure that you're using an appropriate size cuff. Blood pressure should be tested in a relaxed, calm environment. Not easy to do in a busy medical practice, so it's kind of funny that they recommend that. There should be multiple readings of the blood pressure over multiple occasions, so you don't want to just do multiple times in the first visit at your office. It would be have them come back, have them check it again. 3 separate readings to be made at separate occasions. An exception is a systolic blood pressure over 180 or 110 for the diastolic. Then in that case, it's unlikely that it's just because they're nervous to see you. They have high blood pressure. And the 180, the systolic 180 or the diastolic 110 is considered a hypertensive crisis or urgency. So any person who comes in with a blood pressure of 180 over 110, you should be starting medication and considering if there's any symptoms at that point, consider hospitalization. If they're asymptomatic, then would be start medication.